Hi, it's Patrick from Intensive Care at Home, where we help long-term ventilated adults and children with tracheostomy and their families to improve their quality of life in their own home, and we also help hospitals and intensive care units to save resources and money whilst providing quality care. In this week's blog, I want to talk about how we can fight depression in intensive care for long-term ventilated adults and children and their families and make our customers king. Anybody working in intensive care has seen the situation over and over again that long-term ventilated adults with tracheostomy are facing as soon as they realize their massive dilemma. Because they are stuck in intensive care with no quality of life, they are depressed and they're desperate to get out of intensive care. Dependent on other people with no privacy, no dignity, and with no quality of life, the long-term ventilated patients are often left in a side room, often with no natural daylight, maybe with an agency nurse or a junior nurse looking after them, because the more experienced and the more senior staff are busy looking after more acutely unwell patients. The ward rounds in ICU might often see the long-term patients last because there are more urgent things to do in an ICU, and besides, there is not much progress with the long-termer anyway. Maybe the long-termer has caught an infection in the meantime and is now on antibiotics. Depression and the ICU environment is a good combination to catch an infection for a long-term patient. The doctors and the nurses in intensive care might get tired to answer all the questions to the family because there is just very little or no progress or even setbacks, and the family doesn't really want to know whether the PEEP and the pressure support have been reduced. They want to see real and tangible results and not clinical results. And weaning is something that can be successfully done at home as well, with the right level of support and with the right mindset. So what's the solution to the dilemma? Besides the depression, the lack of quality of life, the lack of privacy and the lack of dignity for the long-term ventilated adults and children with tracheostomy in intensive care, there is also the silent depression and the silent desperation for families of those patients who, more often than not, are putting their lives on hold whilst spending long periods of time in intensive care, whilst also neglecting other family members and their personal and sometimes professional lives. Maybe they even take unpaid leave during the long-term stay of their loved one in intensive care. One of the biggest joys in life for a healthy person is having choice. Do we as intensive care professionals notice? Is anybody listening to what patients and their families want if given a choice? Or do we just ignore what can be improved? When do we want to start treating health consumers as customers and create win-win situations? When do we want to make our customers king? I'd like your views on this topic. How do you think depression in intensive care for long-term ventilated adults and children with tracheostomy can be avoided in the first place? How can we make our customers king? I'd love to see your comments in the comment section below. Thank you very much for watching this week's blog, and if you're a health professional in intensive care and you think you know a long-term ventilated adult or child with tracheostomy and their family who would like to improve their quality of life and or their quality of end of life in their own home rather than in intensive care, even if it's to go home for a few days, and if your organization would also like to save some money and resources along the way, or if you simply have any questions, give us a call or simply reply to this email. Thank you very much.